Hey everybody, I'm Dr. Steve, and if you're watching this video, there's a high probability that you have some type of knee issue going on and some type of knee pain. And this video is specifically about the different ways here at Kaizen Progressive Health that we treat and we help people with different types of knee issues. Knee issues are one of the most common problems that we see in this office with people. There is a whole slew of reasons that is, but the knee is a joint that we use a lot through from childhood all the way to old age. And once you kind of had an injury in a knee, my experience is you're a little prone to have them over and over again. But if you can be very proactive with your knee, you're really going to A, usually get better in a short amount of time, and B, even more importantly to me, getting treated and getting better and biomechanically balancing your knee out is going to really help you prevent needing a knee replacement down the road. And knee replacements are one of the most common surgeries that people get when they're past the age of 60. And they're actually becoming more and more common as people get younger and younger. And that's because there is such a prevalence of problems with the knee. So even if you have minor knee issues, I would really invite you to get assessed, get the biomechanics right, because if you ignore or neglect that biomechanic issue, it's like a misaligned tire in a car, and it is going to cause wear and tear down the road. That potentially could cause you to need surgery. So let's talk about the different things that we treat here when it comes to the knee. Well, one of the most common things that we're going to treat is what we call simple mechanical knee injury. And this is just simply the biomechanics of the knee, usually because of an overuse, or you overlifted and put type of strain, sprain on your knee, that you now have an acute mechanical problem. Acute mechanical problems can lead to chronic mechanical problems, just meaning that it didn't heal properly. You've had the issue now for more than a month, more than 90 days. At that point, it becomes a chronic issue, where acute issues are more short-term. Another thing that we will see with knees more often as people get older, but these are common things that we see with people who maybe were football players or did some type of really physical activity when they were younger, is osteoarthritis, arthritic changes that are going in the knee. And we often associate this with aging, but again, if you've put a lot of wear and tear on your knee, you might have the knee of a 20-year-old that we might see in an 80-year-old. And then we have people who are 80-year-olds who have knees that you would expect to see in the 20-year-olds. So this doesn't happen so much because of your age, but it is wear and tear, so you tend to see it more often as people get older. But that's an important thing to do. X-rays, we can assess for that very simply. And with all these things, if we need further testing, we can refer you out for an MRI and do even more appropriate testing to find out exactly what's going on in your case. You may have issues with your knees related to bursitis. All your major joints have bursas in them. They work as cushioning. They also work to lubricate your joints. If that becomes inflamed, it is very painful, and that is a bursitis issue, and we will assess for that. You might have just a tendonitis issue, which falls into the category of mechanical pain. The tendons in the knee, the ligaments in the knee might be your specific issue. There are treatments that we do that are hands-on treatments. There's physical therapy treatments that we do here. And there's also certain supplementation that can help heal these certain things, from peptides to very specific nutrients. We do vitamin mineral IVs. So often with these things too, what's important is you want to give the body the nutrients it needs to heal. Now you may have something severe like a fracture as well too. So again, that is something we really want to assess for and make sure we got right. We do have digital x-ray on site, so we can assess for things like fractures and other traumas. So your knee is a very complex joint. I will tell you both in the short term, if you're experiencing pain, it's important to get it assessed. And really in the long term, the more you can get your knee right, the more down the road you're going to have less problems and just be able to enjoy your life and get the most out of life. And that's really what it's about. So appreciate you taking the time. Give us a call. We're always happy to help out. Talk to you soon. Bye for now.